be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Hello, and welcome to Relatable Rheumatology, From Stories to Studies. I'm your host, Ben Nowell. In this episode, we'll be discussing a topic that is critically important for patients with rheumatoid arthritis: blood work or laboratory tests. For many people with rheumatoid arthritis, or RA, lab tests are a regular part of their healthcare routine. That's because these tests help providers monitor disease activity, track the effectiveness of treatment, and identify potential complications. But for patients, blood work can be confusing or overwhelming. What are all the tests for? What do they have to do with treatment decisions? And what should patients know about them to be informed participants in their own care? Whether you're a physician or a patient with inflammatory arthritis, this episode will provide valuable insights into the evolving role of blood work in RA care. To help us explore these questions, we'll be speaking with Dr. Deen Allen, a PhD in cosmetic chemistry. Deen also lives with RA and has about 17 years of blood work to show for it. We'll also be speaking with Dr. Liana Fraenkel from Berkshire Medical Center and Yale School of Medicine. Dr. Fraenkel is a rheumatologist, a well-respected researcher and mentor, and an expert in shared decision-making. She'll tell us about blood work from the perspective of a practicing clinician and researcher, and how this information can be used to improve patient outcomes. If it's all right during this interview, I'll refer to you as Deen and Dr. Fraenkel respectively, so that it's clear for listeners which perspective is being shared, patient or clinician. A big welcome to both you, Dr. Fraenkel, and you, Deen, for joining us for this episode. So let's start with you, Deen. Tell me, how did you get diagnosed with RA? Was your blood work part of that process?
Ben, thank you so much. For me, it was a long and crazy process. Blood work kind of was part of the process. I was misdiagnosed for about 4 years. And when it finally came for testing with RA, I presented all of the symptoms of RA. So it was, I finally got the diagnosis of seronegative rheumatoid arthritis. So for me, it was a crazy process because I think I might have given more blood during that timeline than I would like to have imagined.
I can imagine. Thanks, Deen. Dr. Fraenkel, what do you say to patients when they're going through that diagnostic process? And in particular, patients who aren't convinced that they have RA because they are rheumatoid factor negative or RF negative?
Yeah. Well, I think it's first important just to acknowledge that in rheumatology, we have very few tests that we can run that definitively make a diagnosis. It's very different than some other specialties. To diagnose diabetes, you have a very specific test that you can do, and the test and the number make the diagnosis. It is not so at all in rheumatology. In rheumatology, most of the time, the diagnosis is made clinically based on a patient's history and the exam findings that they have, and tests are typically used to confirm that diagnosis. Now, we're hoping that changes one day, and we'll be much smarter at this. We'll be able to take your blood, Deen, and run it through a computer and have a much better idea of exactly what your immune system is doing, right? Hematology and oncology, the cancer doctors used to be where we are, and they are much more sophisticated now in making a specific diagnosis based on specific mutations you have in your DNA. We are aspiring to that, and hopefully one day we'll be much smarter in terms of making a more specific diagnosis and being able to figure out, based on what your immune profile is, what treatments you're likely to respond to. And one day, rheumatoid arthritis might be, a name of the past. We might be better at parsing out exactly what type of inflammatory arthritis you have. Right now, rheumatoid arthritis, as Deen, you said, might really represent a wide variety of patients, right? Somebody with a couple of swollen joints and feet that really hurt, Somebody else with the classic picture of first my hands hurt, then my wrists hurt, then my knees hurt. Right now, it's very, very variable. And for that reason, it can sometimes take a longer time to be diagnosed. The other problems, which you alluded to, people might falsely assume that if I take your blood, a blood test, right, and your ANA comes back negative and your rheumatoid factor comes back negative and your anti-CCP, other antibodies we have now for rheumatoid arthritis comes back negative, you don't have that, and so I'm not going to send you to the rheumatologist. That's a big mistake, right? So what we should be doing is be asking you questions about your symptoms and doing a physical exam and basing our decisions based on that. And that's what we try to explain to our patients. These tests are not perfect, right? And actually, they're not always needed. If you come to me and you have rheumatoid arthritis, because I take your history and it's classic for rheumatoid arthritis, and I examine you and you have inflammatory joint disease in a pattern that's classic for rheumatoid arthritis, and you don't have something else that explains your symptoms. That's also really important because we have mimickers in rheumatology, right? Then the blood tests actually are not important. They're not going to change my mind. You can make an argument, I don't need those 2 blood tests to make the diagnosis. Some may argue, I want to be 100% sure, right? That's actually faulty decision-making because there are people just like you who don't have those blood tests that are positive. So if they're negative, it won't change my diagnosis. The other value, though, might be that if the numbers are very high, they actually might mean that your prognosis is a little worse, and I might be more aggressive in my treatment recommendations. But diagnosis right now is based on your clinical presentation.
Thanks, Dr. Fraenkel. Very interesting. So let's shift then from diagnosis, where it sounds like blood work is perhaps in some cases confirmatory or might help with some treatment decision-making. For example, like you said, more aggressive disease. And I'm curious, from your perspective, Deen, what in your own blood work has been particularly indicative or helpful for you now that you're well into your disease journey?
That's the CRP. CRP for me is like the benchmark because I have learned over the years where my baseline is. So when I first started my journey, I had no idea what any of the diagnostic tests were, right? And even I would sit there, get the reports, and I'm like, oh my gosh, what is all of this? And I, really took the time to learn and understand what each of the tests were and what they represented. And then I found that CRP for me is like the marker or the test, because I know where my baseline is. So if I'm 8 or below, I know that I'm okay. But if my numbers are creeping up to 8 and all of a sudden I start to feel, my fingers are getting a little tight. My elbows, okay. Then if I go over 8, then that's when I know I'm in trouble. And then, we'll immediately call my rheumatologist. Hey, we have to talk. What do I need to do? My numbers are a little high. I'm in a flare. What can I do?
That's interesting. That matches up from this study we did recently in Arthritis Power of over 400 people living with RA. And among those respondents, patients perceived that their CRP was the most helpful to them in understanding their disease activity. But still, it was only something like 48 or so % of the respondents who indicated that. And really, I think it's all about the comprehension of the purpose of a particular blood work and what the results mean for people. So my follow-up question for you, Deen, is what would you tell other people? I mean, what are questions they can ask their doctor that will help them get a handle on it?
Yeah, that's a fantastic question. I would tell them to basically take a look at the CRP and maybe SED rate, because some other people I've spoken to have found that one has been very helpful. And then, just say, hey, sit down with the doctor and then just take a look at the history and understand like how your body is responding and, with flares, non-flares, and what those numbers look like. And then you can really start to see a pattern and then develop a strategy around, okay, this is my baseline. I tell a lot of people that I talk to who have RA that really don't understand it, that you really have to understand if you're right. There's so many other tests. It can be overwhelming. I'm a nerd, so I sat down and just basically like studied all of them so I can completely understand what I'm dealing with. So to me, Ben, those two would be the most important, and being able to feel empowered to have that open and honest communication with your rheumatologist.
Thanks, Deen. What about you, Dr. Fraenkel? What do you see in practice? How do you use those tests to talk to patients on the ongoing monitoring?
Yeah. So one, Deen, I hope you're feeling better, most importantly. Good. So I think I want to add just a little bit of caution to what you said, because this pattern is not seen with everybody. So I don't want all patients to feel that they need to know what their CRP is, and that CRP always reflects how active their rheumatoid arthritis is. That's really important. So just like you said, your rheumatoid factor tests were negative. In some people, they can have active rheumatoid arthritis and their CRP is not elevated. And that actually is very annoying to patients, right? Because they don't feel well and their blood inflammatory markers are not elevated. And it bothers them. Is there something, is it really my arthritis? Is it something else? So the opposite can happen, and it can be disempowering to patients. So we have to be a little bit careful. The correlation is far, far from perfect. This is not a blood pressure medication that accurately reflects your blood pressure, and it is not a blood sugar. So it's really important to recognize that in some people, the CRP better than the SED rate. The CRP goes up and down better than the SED rate. But in some people, it does not correlate well at all. So that's really important. If it's not elevated, it doesn't mean your disease is not active, and it's still very important for you to speak to your rheumatologist. And rheumatologists are very well aware of this discordance. The opposite is also true. It's very important not to always blame a high CRP on your rheumatoid arthritis, because a high CRP can be reflective of other illnesses, right? And for example, infection, right? So so you don't automatically want to blame the high CRP or associate the high CRP with rheumatoid arthritis either. So just a little caveat that it's not always perfect, and it sometimes can be very helpful. So it sounds like what you're saying is I might have some symptoms, but I'm not sure if it's related to my rheumatoid arthritis. That's when a CRP is particularly helpful, because it sounds like you're attending more to your symptoms, like you're kind of taking better care of yourself, not ignoring things if your CRP is also going up, which is totally makes sense for you. In others, it might not track your disease as well, right? And if you're feeling unwell and it's your RA, you don't kind of need another blood test, right? Because it's helpful, I think, to rheumatologists when we're not sure. When somebody has pain and fatigue, for example, but we don't feel a lot of swelling. Then if your CRP is elevated, and I know it goes up when you have high disease activity, that's really helpful, because that's going to say, okay, it's time to increase the dose of your medication or to add a medication, right? As opposed to, well, maybe this is due to another cause of joint pain that we should focus on. So sometimes very helpful, an added piece of information, but sometimes does not accurately reflect disease activity. So we should just be aware of that.
It sounds like from diagnosis and even in ongoing monitoring that blood tests are not going to tell you everything.
When we've asked patients about their experiences, this is what they've told us, that my blood tests are not telling my doctor about how I'm feeling, or my diagnosis was delayed because of my blood tests. So, it's just to emphasize they are an added tool, but we need to recognize their limitations.
Dr. Fraenkel, I know that you see people living with RA over many, many years. Is there anything within the blood work that you find useful on the longitudinal basis?
So the blood tests to the rheumatoid arthritis blood tests don't have to be repeated. They don't fluctuate with disease activity. And we don't follow them. They're really most helpful at baseline to, one, make a diagnosis if you're unsure, right? If I know it's rheumatoid arthritis, I don't need blood tests for the diagnosis. If I know it's not rheumatoid arthritis, you present to me with a big red toe, it's not rheumatoid arthritis, it's gout, I should not be ordering blood tests for rheumatoid arthritis, because it doesn't matter what they are, it's not rheumatoid arthritis. But when you're in the middle, if I think this might be rheumatoid arthritis and we don't want to delay diagnosis, then those blood tests, if they come back positive, will push towards starting a medication, right? Or push me towards following much more carefully, or push me towards getting another type of x-ray to see if the person does have, some signs of rheumatoid arthritis, for example, on their MRI that I don't feel, right? So that's when the blood tests for diagnosis are more helpful, or most helpful, is sort of when you're not sure. They add some valuable information. In terms of the other ones, the SED rate and the CRP, that's also really helpful in cases when they correlate with disease activity, when they mirror how you're feeling, like when Deen talked to us about, or when you're not sure again, right? You have some joint pain, you have more fatigue, but it could be related to other things. If your CRP is elevated, that's more support that this is active rheumatoid arthritis, and it is more evidence that we should go ahead and talk about a treatment change, right? Just like Deen, you talked about with your rheumatologist, that pattern for you is very, very helpful. But the blood tests that are most helpful and most important on over time are the blood tests we use to monitor the medication side effects. That's by far the most important part of blood tests in rheumatoid arthritis, both before we start treatment and to monitor treatment. And I talk to my patients about this all the time. We need blood tests to know which medications are safe for you and to make sure they stay safe for you. That's why we need blood tests. The other ones are not nearly as helpful, right? So rheumatologists need blood tests to make sure it is safe for us to give a drug, right? That the patient hasn't been exposed to tuberculosis in the past or hepatitis. And if yes, how to mitigate that. And then to follow specific potential risks over time, like to your blood counts and to your liver, most importantly. Deen, potentially, I'm curious to know whether or not you follow those blood tests over time.
Absolutely.
As
well, yes, absolutely. Because, once I started to really understand, I definitely now take a look at other tests just to make sure that I'm still in range, everything is good. And if I do, and I think my rheumatologist is sort of kind of getting sick of me because I'm like, hey, this level's a little high. She's like, Deen, you're okay. Don't worry, you're fine. I'm just like, okay, just checking.
Dr. Fraenkel, talking about the prognostic aspects of tracking a patient over time, how do blood tests compare with radiographic and imaging data that you have over time for patients? How does that factor in alongside blood work and some of the other things you mentioned?
So that's a great question. So where there is uncertainty around blood tests in terms of their prognostic ability, much less so with x-rays, right? So if you have signs on your x-rays, for example, in your hands and feet, when you first present to a rheumatologist, you're in a different category, right? So what we try to do now with our medications is to prevent those from happening. But once you have signs on your x-ray, we consider you at higher risk for progression. And that's another sign that, there's kind of no fooling around, right? It's like, if you're paying attention to your CRP, if you knew you had your x-rays, you'd be on the phone with your rheumatologist. Let's get going, right? So that puts you in a different category. And that we strongly want to prevent any progression in. Now, it's also important to realize that the x-rays are one tool, right? And we can't afford to get repeat MRIs on patients. And honestly, they would be full of false positives, right? And we might lead to overtreatment. So that's not a good thing either. But it's important for patients to know that, again, that's one piece of information to help us, right, engage in a conversation that allows you to make the best decisions to prevent any long-term damage, not just in the x-rays, but also the things we're not measuring, right? Like heart disease and other vascular disease and osteoporosis and things that really can dramatically affect the quality of your life. So we use the x-rays, we use the blood tests, but most importantly, we use how sick you are, right, to come up with a treatment plan. These extra things will, I think, help us explain to patients why it's so important that they start treatment and that they follow a protocol that will allow us to treat to target, right? That is very important, right? That we do what Deen is saying with the CRP, but with everything, right? We want to treat to target. And sometimes blood tests are important for that. Sometimes they're not. but we want to make sure you stay at a low level of inflammation. CRP, joint pain, joint swelling, right? That will help us minimize any progression of your disease. So x-rays are another test that you can use.
Yeah, and that's a great point. Because of my delay in getting treatment, the RA had impacted both of my hips, and I wound up having to have a hip replacement very early on in life, and that sort of threw me for a loop. I'm like, whoa, wait, what the no? So I wish I had, X-rays, had done those much earlier, because I think, and I could be wrong, but I think that they might have seen something in the X-rays very early.
So it's interesting. I wanted to talk about medication decision making a little bit, and you both addressed the ways that blood work can be used and also the limitations of blood work. It's not the end all be all, but it's very helpful for monitoring over time the side effects of medications, as you both talked about. We're presenting some data from Arthritis Power, and one of the things that we learned from this patient survey we did with more than 400 people living with RA is that 91% of the patients who responded worried that their current RA treatment would eventually stop working for them. And 82% worried that they might waste time trying the next medication that was prescribed for them when it may not work for them. I'm here at EULAR 2023 in Milan, Italy. It's a great privilege to be here with people from around the world learning about all the latest in rheumatic disease research. And I gave a talk on patient perceptions of rheumatoid arthritis blood work and utility of a test predicting response to new medication, a cross-sectional survey in the Arthritis Power Registry. So it's very much on topic for our podcast. And I spoke with a few patients who were in the audience after the session to get their perspective on blood work for RA and even for other rheumatic diseases and how that lines up or doesn't line up with their symptoms and how they're feeling. What's important to you about your RA blood work?
The CRP is what I monitor, and again, the medications I'm on to make sure my kidneys and my liver functions are good. So I'm following to make sure all of that's working. And I also raise questions within my portal to my rheumatologist or primary care doctor to ask questions. I'm like, okay, that looks really high to me. Is that alarming to you yet?
Right, yeah.
And usually I'll get a response back from the nurse after they contact the rheumatologist, and I'll get feedback right away.
So Eileen, same for you. So how long have you been living with RA, and how does blood work come into that experience for you?
Well, I've been diagnosed for 8 years now. I was diagnosed at 29. And the blood work, as much as it tells me at that moment, maybe how much inflammation I have, but RA is a systematic disease. It's going beyond just that. So there's been times where I've gone into my rheumatologist and she's been like, your blood work is great. It's fantastic. But I'm like, but I feel like crap. And my rheumatologist says, okay, well, then we'll go by how you feel. So I don't think the tests are accurate enough. But I think having this precise blood test would not only take a lot of burden off of the patients, but the lack of rheumatologists that we have. How many times do we have to go to the rheumatologist a year if a medication is not working for us, especially when we have to try those cheaper ones that don't necessarily work for everybody who's got more advanced RA. And the burden of RA on people having to go on disability, have to stop working. If we had quicker, effective treatment, we would have better quality of life. And I think that's what is really important to us.
So I was doing all the background information and digging into this, like, different pieces of blood work because there's so many. And the idea of biomarkers is life-changing. And I know I've mentioned that before in different aspects, but it's life-changing because I have been on, in 40 years, all the biologics. And So my first 20 years were bad medications that I had so much destruction. And the last 20 years have been with biologics. So the amount of destruction that I've had in my body has stopped, but I've been on all the biologics and I'm on my second time through on a few. So the idea that I could actually save time and damage it and actually know that if a B cell inhibitor doesn't work or TNF inhibitors don't work, don't waste my time because it's 3 months to 6 months to 9 months of time to even see if there's any efficiency with it.
So the idea of a biomarker that could tell you
Yeah.
that you won't have to waste time on something
Yes. Yeah.
is hopeful.
Oh, incredibly hopeful.
So that was very interesting to hear from patients on the scene. But now let's get back to our guests for this podcast. Is this something that you experienced too, Deen? I see your face in your hands.
100%. And, I had no idea that this would ever happen because once I was diagnosed, we started on a relatively, mild treatment, and then it wasn't working because the numbers weren't coming down. So then we tried first biologic, and I'm like, using it. And I'm like, hooray, yes. Oh God, relief. I'm happy. I'm able to, function and do stuff. Then about a year and a half in, I'm like, oh, what's happening? Wait, my joints are swelling up again. Everything's going crazy. And then started a second biologic, and hooray, yippee, woo, great, fantastic. I have relief again. Quality of life is back. In about the same amount of time, about a year and a half to 2 years, boom, it's failed again. At this point, I'm beside myself because I'm like, will I ever find a drug that will work? Because this is crazy. I don't want to start something new with the third biologic, and then started taking it. And now I've been on that one for years, and I literally call it my liquid champagne, because when I am nearing my time for my infusion, I know it. My body's like letting me know. And then I walk into the infusion center and I'm like, pop the cork. Let's go. Let's get this puppy in me, please, because I am ready for some relief. And this has been, the third one has been a godsend, but there's always this nagging thought in the back of my mind. Will this fail?
Dr. Fraenkel, what do you say about that? And how do you handle the fact that so many patients have that concern? What do you hope for the future of RA blood work to address some of those patient concerns, if anything?
So, Deen brings up concerns that I think are shared with every single patient with rheumatoid arthritis. This is just a widespread concern for people because of the uncertainty whether or not you're going to respond to the medication, and the variable amount of time you have to wait, and the uncertainty regarding each time you start a new medication, whether or not you're going to get side effects. Everybody would have these concerns. Nobody's immune to these. And honestly, the people who are more empowered to take care of their health, unfortunately, they're probably more concerned, right? Because they're monitoring more closely. So it might be an added burden on you, Deen, because you're taking such good care of yourself, and you're really on top of things. So it's an added burden on you. The other issue about, the potential for a medication to stop working, I try to stay away from the word failing, because it's not really a failure, right? It's more that your immune system is now behaving in a different way. Our immune systems are super smart, right? So we just don't understand how the immune system keeps changing with rheumatoid arthritis. But there's a fine balance between, you want patients to be really hopeful that they're going to stay well for a very long time. You don't want them to be worried about when they're not going to respond anymore, and setting up accurate expectations. right? I've learned that from my patients. You kind of need to let them know that this might not last forever, because it's hard to plan your life if you think you're going to be in clinical remission for your whole life. And for some people, it's more urgent than others, right? If you're a surgeon, you need to know, what the potential future holds in terms of flares, being in complete remission, the chances that you're going to not be in complete remission. So I've learned that from different patients that, yes, it's really important to be hopeful. You want to hope this lasts forever, but you need to have some expectations of what can happen so you can plan for that. You also need to know that there are things that we can do if you're not responding to that medication, right? That there are, thank goodness, multiple treatment options now. And as we heard from Deen and the other patients that have participated in others of your research studies with arthritis power, Ben, is that, sometimes it's a third, but sometimes it's even longer. And it's really important to stick with it. Really important to have a rheumatologist you can work with, Deen, as you so elegantly described, that you have a really good working relationship with, and that you don't give up. I hope it happens the first medication, and I really hope it happens the second if it wasn't the first, but we're not in the place now where we can practice precision medicine. So the most exciting labs that I am waiting for, that I hope will be when I am still practicing medicine, is on our ability to draw a blood test and to match that blood test with a specific treatment. What do we need to block? Is it TNF? Is it IL-6? Is it a JAK inhibitor? What is it that you need right now? And that might change over time. And instead of a CRP, maybe we'll be able to see how your immune profile changes over time and preempt those flares. Oh my goodness. So many exciting things to think about, right? But that's where we're going.
It'll be wonderful when that day comes. Deen, what about you? What would you like to see in the future of RA blood work in terms of research and practice, and how it affects you and others living with RA?
Oh, everything that Dr. Fraenkel just stated. I mean, I was sitting there listening like, oh, yes, please let it be so right now, because, it's sort of interesting how we have to almost play a guessing game, to try to figure out exactly, which medication is going to work. Do you need this or do you need that? And, my vision would be to just basically walk into a doctor's office, give some blood, and then they do all this testing, and then come back and they just say, hey, this is what we need to do. And that's it. And, you can get the drugs and life will be great. And the other thing for me also is that I really hope and wish that more RA patients would participate in research. I think, because we just live in these little silos and we don't want to step out of those silos and take the risk or, be involved with research, I think it's a little slow on it's being slowed down because there's not enough research in these areas being done, or there are, and it's just not enough participants. So, for me, everybody I talk to, including myself, I'm just like, I try to encourage as many people as I can to take part in research because it's critical. And we need the information. We need to understand more, and we need to help these wonderful rheumatologists who take a crazy, insane disease and try to make it simple for us to live and have really great quality of life. So, my hat's off to you, Dr. Fraenkel. I appreciate all that you do. Every rheumatologist that hears this, I appreciate all that you do.
Thank you, Dr. Fraenkel. Thank you, Deen, for sharing your stories and your insights about RA blood work. Before we conclude this episode, I would like to pass the mic to my colleague, Dr. Shilpa Venkatachalam, who closely listened to our fascinating conversation. Shilpa, I would love to know your thoughts here. What did you find most interesting in the discussion? What about your own experience with RA blood work?
that was so interesting and so insightful, especially for me as someone who lives with inflammatory arthritis myself. First of all, I found it so reassuring to hear from Dr. Fraenkel that blood work is relied upon to monitor side effects, because I'm always worried about side effects from the many medications that I take myself for my rheumatoid arthritis. I also thought it was fascinating to understand that there can be discrepancy between blood work and how a patient is feeling. So, for example, recently I was coming into a flare. I just knew it. We all know when we're coming into a flare. But my blood work when I went in to see my rheumatologist was fine, not as bad as I was feeling. And it was so helpful to hear from Dr. Fraenkel what my own rheumatologist told me, that blood work is not the only thing clinicians rely on when assessing how their patient is doing. It's acknowledging that it's not all in my head. And in fact, when my blood work was repeated, counts were elevated. This disease, at least today, given the many medications that we have for it, is often invisible. So the fact that clinicians rely on various pieces of information is really helpful. And most exciting to me as a patient was how biomarkers can help in precision medicine as we move into the future. My hope, as someone who lives with RA myself, is for precision care. And it sounds like that is not very far away.
Thank you, Shilpa, very much for sharing your interesting insights and your own experience about RA blood work. We all really appreciate your expertise and for being so open and sharing your own experiences, your own expertise about this topic.
Ben, thank you so much for having us. This is always a total pleasure. And I have to say special thanks to Deen, because as usual, I learn most listening to patients, how they think, what influences your decision-making, your experiences. It's really a very, very valuable experience for us. And thank you so much for your plug for research. Fabulous.
Yes, thank you. And Ben and the team and everybody, Dr. Fraenkel, thank you. And I'm in the same boat. Every time I'm with you, you educate me on so much.
Thank you very much for your time. We hope you've enjoyed this episode of Relatable Rheumatology, where we focused on RA blood work. Living with the rheumatic disease can be a journey filled with questions, uncertainty, and challenges. Whether it's navigating the diagnosis process, understanding treatment options, or managing symptoms, it can be difficult to find reliable information and support. That's why we created this podcast, to bring together real-life experiences of people living with rheumatic disease and expert research evidence to shed light on the questions and challenges faced by those living with these conditions. Remember to subscribe to our podcast so you never miss an episode, and help spread the word by rating our podcast, writing a review, and sharing us with your friends and family. If you have any questions about today's podcast, you can email us at podcasts@ghlf.org, and we'll be happy to respond to your question. We look forward to sharing more information with you during our next episode. This podcast is brought to you by GHLF and HCP Live. Thanks for listening.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.